We saw the list from the state today that the Penrose St. Francis Health Services will get about 2,000 Pfizer vaccines and I believe 1,100 Moderna. So we wanted to ask you, how many workers do you have that fit into the phase 1 category, and will there be enough vaccines for them?
Certainly, right now we're focused on the Pfizer vaccine because that's the first one that's come out, and I believe we just learned about the Moderna today, even though we've been anticipating it. And we really should be able to cover the vast majority, if not all, of the phase 1 A1 providers and associates for that. There's obviously going to be some overlap between the groups, but between the Pfizer and Moderna, we expect to be able to cover all of them.
Okay, that's great. What percentage of those workers do you anticipate might get the vaccine when offered?
Well, we've done some internal surveys, and I believe it's actually been really quite positive, and I believe it's been the vast majority. Depending on which group you ask, I believe it's between 70 and 90%. So much higher than what might have been reported, from surveys out in the public a couple months ago.
We learned this week, I did from speaking with Andy, that the COVID-19 vaccine will be optional for Centura employees. Are employees required to get other vaccines?
The only vaccine that employees are associates and physicians and advanced practice providers are required to get is the flu vaccine. There are obviously exceptions for religious or medical reasons, and then otherwise people will be required to wear a mask, but that's a state requirement, and so to comply with the state, that's what we do as well.
Okay. Will the hospital disclose to patients exactly which company's vaccine they will be given? Obviously, this is much farther down the line into the second or even third phase. Will patients be given a choice of Moderna or Pfizer?
I think it all really depends on availability, but certainly whenever there's an option for patient choice, we fully support that and certainly support transparency because it's important to know which manufacturer or who's the manufacturer of the vaccine because there are going to be slightly different side effect profiles, and part of our education to our patients is what they can expect.
How much money, if any, have you had to spend on equipment to properly store the Pfizer vaccine?
I really wouldn't know that, but we're utilizing freezers and other equipment that we already have. So.
Okay, that's good. So the dry ice, we see all the videos of the dry ice being unpacked, and we were just wondering, is this a major burden for the hospitals or not?
I think for and it goes into the thoughtfulness of the distribution. So the Pfizer vaccine does require incredibly low temperatures and the dry ice, everything else that you're sharing, and a lot of your larger hospitals, referring or tertiary hospitals, would already have that capability. Many of the rural hospitals may not, and so then for them, maybe the vaccines that don't require that, like the Moderna, and I'm not sure about the AstraZeneca, would be more appropriate. So that's all being factored into the allocation by the state and others.
Are you concerned that there won't be a vaccine storage, a cold temperature hub in Colorado Springs, and that the closest locations are Denver or Pueblo or even farther away?
Honestly, don't know that. But as far as any concerns with refrigeration has already been addressed, and essentially the plans to be respectful for the vaccine and the need to get that out as quickly as possible. When we're given an allocation, our intent is to vaccinate our associates very quickly over the course of maybe 4 or 5 days.
Okay. That was my next question for you. We noticed during the governor's press release that he had mentioned the vaccine needs to be administered within 5 days. So is that possible, I guess, for the amount of staff that will need it on the first phase?
Well, it does mean that there are going to be a lot of staff, including myself, providing the vaccine to others, and so we simply plan for it.
Is it okay for someone to stop wearing a mask once they get the COVID vaccine?
I haven't heard definitive guidelines, and we always utilize CDC guidelines. My suspicion in the beginning that within places of work there may be considerations of that, but until it's more widely administered, it would probably be a little too disruptive or unnerving to folks in the community, seeing several people who are not wearing masks, potentially thinking they're being exposed, not realizing that they've received the vaccine. So there's going to be more to come from that.
This question, I think, is based on some researchers we spoke to at CU Boulder who had kind of said that based on their research, it might be wise for people who have had COVID-19 to basically allow people who haven't had it to get vaccinated first. Is that consistent with anything you guys have studied?
We haven't done our own studies. We rely on what's been reported. There are mixed results and mixed reports of how long that immunity lasts. Some, I believe, perhaps not the best studies, have suggested maybe the immunity might only be a few months, but ones that really look at T cells and the fact that once you're re-exposed to an antigen or a virus, there are mechanisms within the body to rapidly produce those antibodies that simply on a test might not show that they're there until you're re-exposed. And so there's a lot of evidence actually to suggest that there's long-lasting immunity from that. So our advice at this time is even if you've been exposed and you know for sure you've actually gotten tested, didn't just think that you had it, that you still get the vaccine, because how robust your own immunity was just by having the infection or how much you were exposed is not clear.
Okay. Vaccine trials are beginning on teenagers. Do you know if there are any plans in the near future for clinical trials on younger children?
I've only heard that just from news reports. I believe a lot of these vaccine trials did not address pediatric patients, as well as other groups like people who are pregnant, and so they will need to extend their study trials into those populations.
Okay. I saw some questions popping up, I think yesterday, people who were concerned about being allergic to the ingredients in the vaccine. Have you heard much concern over that? Obviously, I don't know the exact ingredients.
It has frequently come up with other vaccines where there may be components of egg or other things like that, or the preservative that's in the vaccines. So not necessarily the component of the vaccine, but part of the method of delivery. And so if someone's had allergies like that, it's very important that they share that with the clinicians and the vaccination team so they know that in advance. But otherwise, I haven't heard any specific concerns like if you have egg allergies, you shouldn't get these vaccines. I have not heard that at all.
Okay. Do these vaccine shipments that are expected possibly next week include the first and second shots, or will a later shipment contain the second part of the vaccine?
It's a great question, because there was a lot of thought that essentially you'd only be vaccinating half the number of people if you were utilizing half of the supply to be the second round. But that's not the case, because this is a rolling process of delivery of vaccines. So we are administering the entirety of the first allotment of the Pfizer vaccine. We'll do the same with Moderna, as we know that we'll have more shipments and more allocation coming later for those second rounds.
Okay, so the consideration of having the right number 24 or 28 days later, depending on the vaccine, will be an important consideration from the state, it seems like.
Correct.
Okay.
but have a lot of faith in that.
What else do you want to mention while we have you? What else do you want to get out there?
First, it's wonderful to know that we have good news on the horizon. I think everyone has been feeling very down the last few months with just seeing the large surge that we've had this fall. And in earlier interviews back in the spring, if there was a surge, I downplayed and I did not believe that the surge would be as much as what we had in the spring, and I was completely wrong. And so this has been a hard time for everyone. So knowing that help is on the way is of tremendous importance. With that said, it's going to take a while, probably into March, April, to get the vaccine to all the people that need it in the general community. So it's still important to practice the things that we've been saying time and time again about wearing the mask, washing your hands, maintaining the physical distancing, and also particularly during these holidays. We've had a major surge now, and we're starting to see our numbers come down a little bit, which is encouraging, but we also expect them to go back up just because of the holidays and gatherings that are just natural that are going to happen. So as much as we can still maintain those best practices of wearing the mask, washing the hands, and until we're later in the spring are still important.
You know, obviously we'll be looking to local public health officials and the governor for some guidance in the coming days, but what would your recommendation to people be for Christmas as far as gathering?
If at all possible, to keep the gathering small and within your immediate family, so that you're not potentially exposing others, and particularly between families, because I believe a lot of the outbreaks and a lot of spread has been in the community and in the households, not necessarily outside or in places of work. So it's just important to be very conscious of that, and particularly if you have loved ones that are otherwise at high risk because they're part of our senior population or they have other medical issues, just be very careful around them. But at the same time, this is a time for us all to come together and be very thankful for our loved ones, and I don't want to take that away from people either.
The numbers we saw from the state over the past couple of days were the deadliest in El Paso County that we've seen, you know, really since the start. Can we link that back to Thanksgiving, do you think, or overall, you know, fatigue for the mask wearing and the social distancing?
I think it was a lot of the factors leading up to Thanksgiving. Typically, if there's been exposures, we would start to see the effect of that maybe within 2 weeks. And so I don't think that what we've seen so far has been related to the Thanksgiving gatherings, but we're concerned that we may yet see that. And so that's what we're still very cautious about. But yes, I think everyone, I've been fatigued. I know everyone's fatigued with it. And then there have been other reasons why people have gotten together. I think it's natural. Unfortunately, it's been very difficult.